I'm joined in our booth by a representative from Amylin Pharmaceuticals, Craig Eberhard. Hey, thanks for coming on the show.
Thanks for having me, Scott. Yeah, thank you.
They have one of the most innovative products to come on the diabetes market, probably the most innovative product that I've heard of in all these years. And we're going to start by talking about Byetta. Why don't you show us the pen, tell us, well, I should say what I know. I've had friends that have lost 100 pounds taking this product. I know people are using it off-label to lose weight, people that are pre-diabetic, and it seems that you have a huge market for this, huge untapped but I'm kind of rushing things. Let's talk about who it's indicated for. Yes.
All right.
Yes.
Byetta is indicated for patients with type 2 diabetes who have failed on either metformin, sulfonylurea, TZD, or any combination of those. So it's not indicated as monotherapy, but as adjunctive therapy to oral medications.
Okay, let's stop there. Why not? Why shouldn't a newly onset type 2 that's overweight take your product?
Well, we're doing studies and actually have submitted to the FDA for a monotherapy indication. The initial indication and studies were for adjunctive therapy, and that a typical patient's going to go on metformin or some other form of oral therapy, and then, as you know, progress from a number of orals and eventually will progress to insulin. This is indicated prior to insulin. There are some definite advantages in terms of not only glucose control, but weight benefits for most patients. And it's a single dose, you don't have to titrate, you don't become hypoglycemic when used in combination with metformin.
Now, Craig, when you say it's indicated before insulin, is that like somebody decides the order that these drugs are going to be prescribed in, and who does that?
Well, it's not somebody decides. We look at the actual clinical studies and where is it utilized. And so if you could use a medication that controls your blood sugar, but also can help you maintain, or in most patients, lose weight, that's beneficial. As you know, many oral medications and certainly insulin, you can have weight gain associated with your usage of the product. This has some sort of satiety or neurohormonal effect where you eat less. And so it's nothing more magical than you feel full, you don't eat as much. If you have some other sort of regimen of diet and exercise, you're going to be losing more weight than if you just did diet and exercise alone.
So I'm still confused as why someone wouldn't want to take this right off the get-go.
Well,
and avoid all of the failures of the other medicines.
Sometime next year that's a chance for that to occur with the monotherapy indication. But from a standpoint of us, promotionally with physicians and diabetes educators, our indication, we need to speak on label with the FDA-approved label.
Okay.
So it works in monotherapy, it's safe, however we're not indicated and we're used adjunctively.
I see. So I think last year it was going so well that people couldn't get enough of it?
We were selling more than we can make, is what that's called, and people say that's a good problem to have. Well, it's really not. It's not helpful for the patients, the physicians, certainly.
Especially if they've started.
We notified physicians early enough to hold on initiating for new therapy. We never ran out of drug for existing patients. So we were watching the projections. We were selling a tremendous amount every month. To where we're the fourth most often prescribed branded drug for diabetes, and first year on the market, it was really doing quite well.
What was that, the fourth
most prescribed branded product for type 2 diabetes. After the two TZDs and Lantus, Byetta had that position last summer when we were really on a rocket. Had physicians hold, we had an additional supplier, making more, and obviously we have plenty of Byetta now for current and new patients.
Now, Craig, with the recent news about Avandia being not so good, have you seen an uptick in?
I think all products, certainly Actos at this stage, doesn't mean it will long term, but that's going to be determined, by the FDA and physicians and other prescribers. We've seen an increase, but really more of our usage with Byetta is for that patient that's been on a couple of oral medications, usually metformin because it works and it's generic, and then progressing to either a TZD or sulfonylurea, and then a physician has a decision. Does he initiate insulin sooner? Do they start Byetta? Do they add a third oral agent on? It's an art, not a science, and everyone has different approaches, but there's certain benefits, obvious benefits for Byetta for certain patient types.
So is this it comes in a pen.
Yes.
And this is like a demo pen.
It's a demo.
So it's a real thing.
Yeah.
So you have to take an injection.
Right.
And I'm hearing that because of the effect, people don't mind taking the shot.
Well, if there's
They used to, we've got all these inhalable insulin, and they used to think nobody liked injections.
That's
but
true.
I've heard that your product is sort of showing people don't mind.
Well, you just have to have people take the product. So that's a 28 or 31 gauge needle.
That's
You
very
always
small.
tell people you don't feel it. They never believe it. When they actually do it, they don't feel it, especially where they're injecting it into their abdomen or leg. It's painless. It is twice a day, with your major meals. And the thing is, whether you're 100 pounds or 400 pounds, it's the same dose. And so you don't need to titrate based upon body weight, age, sex, amount of food you've consumed. It's the same dose, because once your blood sugar gets to a normal level, it stops working. So it's hormonal in nature, physiologic like our bodies are, and has an opportunity to work but not drive you down into a hypoglycemic state.
Okay, so this is for type 2s.
Yes.
Now tell us about your other product, Amylin.
Amylin. Amylin is our first approved product. We had both approved about 2.5 years ago. It is a synthetic version of amylin, the hormone. So all people produce not only insulin in their beta cell, the pancreas, but also Amylin or amylin, which is the natural occurring hormone. Amylin itself is not a product that can be manufactured in its truest form, so we have a synthetic version in Amylin. Amylin is added to your mealtime insulin, and so you're on a basal insulin when you reach the stage where you add a mealtime insulin and you're still not controlled, or you have wide-ranging fluctuations or excursions, or you're just not at that level that you or the physician wants. You can add that additional hormone that your body's not producing. Whether you're a type 1 or type 2 patient that's progressed to mealtime insulin, Amylin's an alternative instead of adding more and more mealtime insulin.
Okay, and you take it at meals?
Take it at meals, yep. It's some additional injections, but what it will do is help you in your A1C control. It will compress the fluctuations, the highs and lows, and most people with diabetes spend a lot of their time focusing on staying in that right zone. And then it is also a neural hormone where it has satiety effects, and there's weight loss associated with Amylin in most patients as well, both type 1s and type 2s.
Okay, I was just listening to Nicole Johnson saying she takes 10 units, and is that 3 times a day?
Mm-hmm. Yes.
Okay. And that's the same unit measurement of insulin?
Well, it comes in micrograms, but many physicians convert it to units because the patients are consistent and familiar with that. So,
I see.
But it's at each major meal, you're adding it to your mealtime insulin regimen.
Now, as I said earlier, I'm with Kaiser, and they're great. They take good care of me, but they don't want to buy me the Amylin. And I guess it's $250 a vial per month.
Well, to be realistic, I'll put it in terms of cost per day. It's about $6 a day for type 1, it's about $12 a day for type 2. Now, patients with
Amylin, type 2s take twice as much?
They take twice as much Amylin in terms of the requirements to get the benefit. Very similar to insulin. Type 2s take more than type 1s typically of insulin. What we have, 75% of the covered lives in America are on a tier 2 copay. That's a branded product, so that could range from $25 to $35 a month. So for most patients, they're in situations where they're paying a couple of dollars a day for their Amylin. In a situation where Kaiser, where we're currently not on formulary as yet, then it's a cash paying basis, and something that we're certainly working with Kaiser and other health plans to put us in a position to demonstrate the value to where, as a Kaiser patient, that you could make it more affordable for yourself from a copay standpoint.
So you could offer me a discount as a cash paying patient?
We can't work directly with patients, as you know. Obviously, caregivers in our managed care group.
So if my Kaiser doctor prescribes it, will their pharmacy dispense it at full price for me? Or how do I get it?
How do you get it?
Give me some advice.
You need a prescription, and in terms of if it's not on a formulary, it's a decision as a patient. Would you go ahead and pay cash for that, or you switch your plan? Quite honestly.
Yeah.
And so 3 out of 4 people have in a situation where Byetta and Amylin are both on a tier 2 level. Over 85% are tier 2 or tier 3. So there's selected plans around the country. Certainly certain parts of the country are
I can't change my plan. I have a small company, and actually other plans say, well, we'll insure everyone but Scott. They like cherry pick, which the health system is about making money, and they don't want to insure patients that have a chronic disease. And Kaiser, I put in a good word for them because they were the only company that would insure my company without saying, take Scott off the plan and we'll insure you.
Yeah.
I mean, that's pretty unfair of companies to say that.
We've made good progress with Kaiser. My dad's a Kaiser patient. My dad's on Byetta. He got his Byetta through the endocrinologist at Kaiser, and we're working with them for that.
So Kaiser's paying for Byetta?
Kaiser will pay for Byetta with an endocrinology prescription. Yeah.
Okay. Just not Symlin yet?
Not Symlin yet.
Okay. So
we have work to do.
Yeah, maybe there's hope. But anyway, so if I got a doctor prescribed, I could go to Walgreens or any pharmacy and just pay for it?
Sure. Yeah.
Okay. Well, I'd definitely like to try it, so I just continue to keep working at Kaiser, because I think 1 month might be nice, but affording it year-round would be very expensive.
Yeah. No, it would be. I think we realize that. We're doing everything we can to demonstrate the value. If patients can get better control, have tighter control, improve their A1C, which, as you know, is what every managed care plan wants to do, because of the cost of a patient with diabetes is several times higher than a non-diabetic. And then if there's weight loss, that's a benefit to the patient at this stage, until we prove the benefits or health and economic benefits of losing weight is positive overall. But we have to prove that in order for plans.
Are you sponsoring some studies?
We're looking at some current retrospective studies, patients with other managed care companies that have been on therapy, and you look at their overall diabetes medication, their overall hospital stay, their overall costs. It's intuitive. If people lose weight, they're going to be healthier.
Right.
And we just have to prove that and put our money where our mouth is in terms of pharmacoeconomic studies.
Well, I'm really excited what you're doing. And thanks for coming on our show to talk about these 2 new products that I just hear nothing but good things about.
Great. I enjoyed it.
Thank you so much, Craig.
Thank you, Scott.
All right. That's great.